Hello students, so continuing with the healthcare sector as a service sector, the services of a hospital can further be classified into emergency services, outpatient services, inpatient services, intensive care, operation theatre, and diagnostic services. So we'll be discussing about some of the services like what is the emergency service. So emergency medical service is the treatment given to the patient in time of urgent need. Okay, so when the patient cannot wait for the treatment and it requires urgent medical care, then the emergency medical service comes into the play. And the patient is when if they visit a hospital, they are supposed to go and visit the emergency medical service department. Now the goal of this service is to satisfactorily treat the patient in time and decide for the next definitive care. So for example, if a patient comes to the emergency department with a cardiac arrest, then the main goal of the emergency department is to stabilize the patient, give the patient enough support so as to facilitate the airway, breathing and circulation. And finally, when the patient is stabilized, then diagnose the patient for the cause of the cardiac arrest for the patient, and then further decide what is going to be the further course of treatment so that the patient doesn't get any further episodes of cardiac arrest and it can be prevented. So in case of road traffic accident, if you see, in case of drowning, you see, whenever there is any such kind of an incident where the airway, breathing or circulation is hampered and the patient's life is in danger, and when the patient is suffering from unbearable pain or maybe in comatose state, then the patient visits the emergency medical service. Then comes the outpatient department. So outpatient department is also known as the mirror of the hospital, and which reflects the functioning of the hospital being the first point of contact between the patient and the hospital staff. So patients visit the OPD for various purposes like consultation, daycare treatment, investigation, referral, admission and post-discharge follow-up. So outpatient department is being visited by patient who are ready to wait for the physician to see them. And in case of outpatient department, the call or the consent lies with the patient that which doctor they want to see. But in case of emergency medical service, not like that. So there is, because emergency medical service is being headed by an emergency doctor, so the patient doesn't have any upper hand in choosing which emergency doctor will be treating them. But however, whoever is available on the duty will be we will be looking after the patient, because the primary goal is to stabilize the patient. However, in case of our outpatient department, the patient can even take a prior appointment for the doctor previous day, previous month or maybe previous week. So they can take the appointment of the patient and then go and visit the patient on that particular time. And the physician is also as per the patient, and timings are also fixed previously, and the patient is ready to wait. Patient of course might suffer from some kind of discomfort, but then they are ready to wait for the patient, ready to wait for the physicians to look after them. So that is what is an outpatient department. Inpatient department. So what is an inpatient department? We have already discussed this in the previous in other subjects as well. But inpatient department, it is a unit of the hospital where patients agree to stay in the hospital and get the required treatment and attention. And it is not that they just see the consulting doctor for some time and go back home. No, they don't go back home. They stay there at least for 1 night, 2 night, or maybe a couple of days, and then get fully recovered, and then they go home. So that is what is an inpatient department. And the department is being equipped with beds, medical equipments, and round the clock the doctors and the nurses are available. So we'll continue with this lecture in our next video. Thank you.